Hi, welcome to Colores Latinos TV. I'm Nancy Peña. As you know, Colores Latinos TV is being broadcasting in more than 28 channels on the local TV around New England. And thanks to our link in YouTube, you can watch us in Europe and Latin America as much as you want it. As you remember, we are creating a mini-series thanks to the support and participation of the Lowell Community Health Center. Today, we are going to discuss another topic, and it's very important for our communities: health benefits programs, how to apply for insurance, health insurance, what is the criteria, who qualifies, and what are the benefits. And I just want to welcome today to my two guests from the Lowell Community Health Center. I have Roeun, who is Outreach Enrollment Coordinator. Welcome to Colores Latinos.
Hi.
And we have Rosa, Realejo, who is Office Manager, also from Lowell Community Health Center. Welcome both.
Thank you. Hi.
Thank you. So as we know, in the Massachusetts, we have a Health Reform Act. And I'm just going to read that for you. This is, it says that the Health Reform Act is a state law that passed in 2006 that requires all adults, Massachusetts residents, to have health insurance if they can afford. Residents without health insurance face a tax penalty. So we just want to open our discussion today with Roeun and to ask you about what are the health benefits that you offer in the Lowell Community Health Center.
Well, first of all, I'd like to thank Nancy for giving us the opportunity to talk to people about health benefits. Well, in Lowell Community Health Center, we help people with insurance. Basically, we help them with a Affordable Care Act applications for Mass Health, for Connected Care Plan, which is the new plan because Commonwealth Care is going away. So we have now the new plan, which is called Connected Care Plan, and we also help people with the health safety net, the applications for health safety net. So when people apply for health insurance through Health Connector, they may qualify for three types of coverage, health coverage. Mass Health.
Okay.
In other states, it is called Medicaid, but here in Massachusetts, it is called Mass Health.
Okay.
Well, and Connected Care Plan, as I have mentioned earlier, and Health Safety Net, or it is known as free care.
Okay, great. Now that you mentioned that, I just want to ask you if you can please specify a little bit more the difference between each insurance that you mentioned and what is the criteria for our audience to qualify.
Well, so here in Massachusetts, if you are the resident and you are a legal permanent resident, you're a citizen, and your income is at or below 133% of the federal poverty level. Let me give you an example of
Sure.
the poverty level. If, let's say, a single person who earns $1,294 at this amount of money a month or below, then he or she is eligible for Mass Health.
Okay, let me go a little bit in details because we want to discuss this topic as in very details and deep because I know it's very confusing and a lot of people have a lot of questions, and even myself, I am confused. Mm-hmm. For example, you are talking about Mass Health standard right now, correct?
Well, so there's many kinds of Mass Health.
Exactly.
We have Mass Health Standard, Mass Health Common Health, Mass Health Care Plus, Family Assistance, the Limited. So basically, we at Lowell Community Health Center, we don't make a determinations on eligibility, who qualifies for what program. But what we can help people with is we fill out an applications, paper applications, because the electronic application is not up and running. There's still a lot of problems with the system. So that's why now we help them with the the paper applications. So we fill out the applications and we fax it over to Mass Health or to Health Connector. And then they're going to screen the applications and they're going to make the determinations on eligibility. So let's go back to the criteria. Who's qualified for Mass Health or Connector Care Plan or Free Care or Health Safety Net? Well, first criteria is you are the resident of Massachusetts. That is the most the most important thing. And second, you have a immigration status. You are legal permanent resident, or you are the U.S. citizen.
Okay.
And another criteria is the income. So they're gonna look at your income. If your income is over the Mass Health limits, then you may not qualify for Mass Health, either standard or Care Plus. It depends on the income. And let's say so when you apply for Mass Health and then you don't qualify for that, you may qualify for Connector Care Plan because the income limit is different.
Okay.
Or at least if you don't have any immigration status, you can apply for Health Safety Net.
Which means free care.
Free care.
That safety net is like the new name for free care insurance, health insurance.
Right.
And it's very limited also, right? Because
Right.
it covers at least, if I remember, covers some basic stuff like emergency. If you have an emergency, if you need to run to the hospital. But another question I have for you, Ren, and I think very important, is, for example, can you tell us the difference between Mass Health Standard and Mass Health Limited? Because sometimes people get confused. They says, I have Mass Health, and because they have Mass Health, they think that under Mass Health title, they have all benefits.
Okay.
However, we understand that Mass Health Standard is completely different than Mass Health Limited.
So Mass Health Standard is a full coverage. It's the best Medicaid coverage. It covers almost everything. Inpatient, outpatient services, including dental services and visions, eyeglasses. It covers everything. And now there's a new additions to the coverage. It's the transportations. Mass Health now pays for transportation if you have, let's say, Mass Health Standard. And for long-term care attendant, you also eligible for that if you wish to apply for that. So you can also have the regular visit, the checkup, screening, but limited. Mass Health Limited is just for emergency. It covers emergency services only. So when people have Mass Health Limited, it comes with Health Safety Net, or you call it free care.
Okay. And who qualifies in terms of immigration status? Who qualifies for Mass Health Standard and Mass Health Limited? What is the criteria and what documents they have to
Okay.
bring to you?
Well, if you are the resident of Massachusetts, you are a legal permanent resident and you have been here in the United States of America for more than 5 years. And so you are the U.S. citizen, and your income, as I have mentioned earlier, it depends. So your income for a single person is at or below $1,294 a month. And for young adult, 19 and 20 years of age, the income can be at or below $1,459
Monthly.
monthly.
Okay.
That's your income. So if your income is at or below $1,459, then you qualify for Mass Health.
And this is for one person.
This is for one person.
Okay, it's no family size.
No family size. So income varies according to the family size. Well, if you are pregnant, your income could be at or below $1,945.
Okay.
Okay.
To qualify.
But yes, to qualify for Mass Health. Well, so but right now, if a woman is pregnant, regardless of their of her immigration status, whether she's a legal permanent or she's undocumented immigrant, she still qualifies for mass health standard.
And wow, that's amazing.
Yes, so if you are pregnant and you report, so it is very important. Let's say a woman now is on mass health limited, and now you are pregnant, you have to report to mass health saying, well, I'm pregnant, and then they're gonna give you mass health standard right away.
Do you think that she get the standard mass health standard because the baby who what we are expecting now is a citizen of United States? So do you think that this is the kind of situation? Because
I am not quite aware of that, but what I am aware of is that if you are pregnant, then you qualify for mass health standard.
And do you
so a baby who is born, then a baby gets mass health standard right away from birth until he or she reaches 1 year of age.
And after 1 year, what happens? The insurance change for the woman, for the mother, and for the kids,
for
or
both
just
for the moms and the kids. It depends on the income and your status.
also now after the baby is born, we wait 1 year, and after we review again the insurance,
Right.
the health insurance, and after that it depends the income and the status of the woman. The insurance can change. Now then we talk about changing. Maybe you don't have the answer, but could you just explain to us and to our audience how important it is for our audience to check the mail and to review any letter that the insurance sent, because insurance are changing every 6 months, every 3 months. And sometimes people can lose the insurance just because they don't read a letter, or because sometimes they don't understand. But the good news is they can bring the letter to your office and you can help them.
Right, it's very important to keep an eye on your mailbox to see if there's any letters from Mass Health, because sometimes when you get a letter and then you don't see it or you don't return the information Mass Health requires, then it might terminate your coverage. So it is very important. For example, if Mass Health requires you to return the absent parent form, let's say the mother and children, and Mass Health doesn't have the information of the father, so they requires the information from the father. It's called absent parent form. If you don't return this form, then within a certain periods of time, Mass Health will terminate your coverage.
And what, for example, now that we are talking about terminating the services, what these people can do? Let's say we have a client and she or he completely is, they don't have insurance anymore.
Okay.
What is the recommendation for them to get back to their health insurance?
Well, the most efficient way is to go to local health center. We have health benefit staff who can speak different languages. We speak Burmese, Karen, Portuguese, Spanish, Khmer, Cambodian, or if we don't have languages in our office, we call interpreter for assistance. So the best thing is to go to local community health center or any community health centers where you can seek assistance from staff from health benefits advisors.
To renew the insurance.
To renew insurance. If you have a letter, let's say you have a letter, but you don't really know what to do with the letter, you don't understand what it is, then just bring the letter to us. We can help you with that.
Excellent. How about insurance for children?
Well, the children can have insurance under the parents.
Okay.
Under the parents. But right now, children still can apply. Let's say a mother who's working and she gets insurance from her job. It's a private insurance. It's called employer-sponsored insurance. Then the children may qualify for Mass Health standard. So the mother or the parents have to apply, but the parents may not qualify for Mass Health, but the children may.
I have another question for you. For example, for immigrants communities, sometimes we know that a lot of immigrants then just arrive to our country. They are afraid to apply because they think that the health center will share information with immigration officers. And how about that?
Please don't. I would encourage them to come to us, or they can apply online, or they come to local community health center. We can help them with applications. MassHealth will not report their immigration status to the immigration's office, as far as I know. And so don't be afraid. If you don't have any status, if you don't have any immigration documents, you still qualify for at least free care or health safety net, as long as your income is at or below $3,890 a month.
Okay.
That's your monthly income, or your yearly income is $46,680
For one person.
for one person.
Okay.
For two persons, your income, your annual income should be at or below $62,928.
Excellent. And how about the documentation they need to bring to you? For example, somebody who is a citizen and somebody who doesn't have any documents. What kind of information they need to bring to you in order to apply?
Well, for citizen and for legal permanent resident, you need to bring the last, if you work, you need to bring the last 2 pay stubs. You need to bring the photo ID, the birth certificate if you're a citizen, or certificate of naturalizations, or certificate of citizenship, or your green card if you are a legal permanent resident.
Okay.
For those who don't have any immigration documents, you don't need to bring anything.
Okay, just
Right. You just
show up.
show up and we fill out the application.
That's amazing. And it's important that you mentioned that you provide different languages. So I just want to encourage our communities, not just Latinos, because you know Colores Latinos is for all our communities and bilingual communities. And we just want to invite you and encourage you, remind you that if you don't have a health insurance and you are afraid, then the community health center is going to share information with immigration officers. We have Rand here saying that is not the way it goes. And you have your privacy, and you have the right. That's very important. You have the right to have health insurance, especially in Massachusetts, because if you don't have it, you can face some fee when you have to report taxes. And it is not just about paying the fee, but it's important for you to have the health insurance, especially if you have any emergencies. And it's important for you also to take care of your health and your family's members also.
I couldn't agree more, because it's not just about, tax penalty.
Yes.
It's not that much, but it is very important to take care of your health. With insurance, you will not get a big bill. And you can also have the regular health screening, health checkup. With free care, with health safety net, you can be seen at community health centers like other health insurance. It's not insurance. So health safety net is not insurance. It's not considered as insurance, but it's a health coverage. And you can be seen in community health centers. And if you need to see a specialist, let's say you see your primary care doctors in community health centers, and then your primary care doctors will refer you to Boston Medical Center to see a specialist, and it covers everything.
Interesting. Now that you mentioned that, I just want to aware our communities, and I want to open the discussion about when we have limited insurance, like a health safety net or MassHealth Limited. Sometimes we don't understand why we had to be transferred to a different clinic. So maybe Ryan can explain us that, why you had to be transferred. Let's say you are seeing your doctor here at Lowell Community Health Center, but you need a surgery. Then perhaps, we don't cover that here, but you can be covered in a different hospital because the health centers has like a partnership with other hospitals, right?
Correct.
So could you please explain us more about that?
So in general, when you go to community health center, say low community health center, then community health center is a primary care. So you see your primary care doctor, and then if you need to see a specialist, let's say it requires procedures and stuff like that, then you may get referred to, let's say, low community health center. No, I mean low general hospital, or some hospitals in Boston.
Okay.
So well, it's the procedure. The procedure is this. First, you need to when you have an insurance. Let's say you have Mass Health, either Mass Health Standard or Care Plus or any kind of Mass Health. First of all, you need to see your primary care doctor. That is the first step. And then if you need to see a specialist, then your primary care doctors will refer you to see a specialist. Some people, they are not aware of that. Why can I be treated here? So you have to understand that community health center do not provide the specialty services.
And now that you mentioned that, it is important not just to mention that the community health center, as Rand mentioned, is just for prevention. It's like a prevention,
right, prevention.
And like an emergency. For example, if you need to check something with your vitamins, your medications, annual, like a checkup, like annual check. But if your doctor finds something, especially in the community health center, they need to refer you to a different hospital, and sometimes could be in Boston, sometimes could be in Lowell. And the other thing is that it's important to understand that most of the time you will need a referral. Be careful, just if you just want to go to a different hospital and ask, if you want to go to a different hospital and make an appointment without a referral, now you can have some kind of issues with a bill. Because sometimes I understand and people says, oh, I like this doctor at, let's say, a different hospital in Boston, and I want to be treated by this doctor. Now the insurance are working since always, but the insurance are working with certain partners, with certain hospitals. So even though you want to choose that doctor, perhaps that doctor doesn't belong to what is under the umbrella. So we want to just make sure that you follow up all the steps in order to have treatment, referrals, surgeries. So after the treatment, you're not going to have like a huge bill. If you choose to see somebody else, then it's not under your umbrella. We need to understand that, right?
Right, unless you have a private health insurance with a PPO plan, then you can
choose.
Yeah, you can choose. You can go to any specialist you would like to.
But this is a different insurance. It's a private and it's very expensive insurance.
Yes, it is.
It is. Go ahead, excuse me.
Well, I just want to friendly remind people that when you have Mass Health Standard, let's say you apply for Mass Health or Connected Care Plans or Health Safety Net, and you have been approved for Mass Health Standard or Care Plus or Family Assistant. It's not the end. It's not just, oh, well, I have Mass Health Standard. That's it. No, it's not that. You need to enroll into a health plan. So when you have Mass Health Standard or Care Plus or Family Assistant, you need to enroll into a health plan.
And people can choose what is the enroll plan they want, or you can guide them also?
We have some information on the health plans, but we can't really tell people which one is better than which one.
So they have the obligation
options. Yeah, they
to
have
read.
like 6 options or 5 options. If they have standard, they can enroll into primary care clinics. It's PCC or neighborhood network, for example. Well, so that is very important. So if they have Mass Health, they have to enroll into a health plan, and then they have to pick a primary care doctor.
Okay, so it's the responsibility of the patient to review the information that the Mass Health send you, and you have to review and read, and to choose the primary care doctor and what plan you want to be enrolled. So it's not like I signed Mass Health and I'm all set. No.
Okay.
You need to review and choose who are you going to work with, right?
Right.
Excellent. I think that we are almost, again, we are always having very important topics, and we are gonna just jump now to Rosa Realejo. But before we do that, I wanna ask you, Ren, what is the best way to reach you, and if people are interested in to apply or have more questions about insurance, health insurance, where we can reach you?
You can call us. It's the number, the local community health center number is 978-937-9700.
Okay.
And you ask for health benefits advisors. If you speak Portuguese, you ask for Portuguese-speaking staff. If you speak Spanish, you ask for the Spanish-speaking staff. Well, or you can come to local community health center, which is on 161 Jackson Street, Lowell, Mass. 01852.
Well, thank you so much for being with us, and thank you for bringing such important information today, Ram. Thank you so much.
You.
Welcome, Rosa, to Colores Latinos TV.
Thank you.
You are the
Thank you.
office manager, and I just would like to ask you, before we were having a topic with the family planning program in the last episode, and they were mentioned the importance for teenagers to, to have education about prevention, but now you want to talk about health insurance also, right?
Yes.
So what kind of benefits do you provide for teenagers in the community?
So our department is grant funded. We have a grant through the state. So the grant is for patients that don't qualify for insurance and for teens. And if say a teen is looking to come in for confidential services, but they don't want to use the parents' insurance, because sometimes they have Blue Cross or Tufts, and they send statements to the home explaining why the patient was there, and they don't want the parents to find out, so we can use the grant for those teens. If they have mass health, neighborhood health, we can see them with that insurance because they don't send statements home. So, we can see those patients with those insurances.
Do you mind to repeat the insurance that doesn't send the statement again, please?
Mass health, neighborhood health, any insurance that's through mass health, they don't send statements home. Excuse me.
Okay.
The ones that do send statements home is private insurance like Tufts, Blue Cross, Aetna, and a lot of our teens do have those insurance through the parents.
Okay.
And a lot of them don't know, or they're afraid to come and see us because they think we're going to bill their insurance. And we want to make sure that they know that they can come and see us, and they don't have to worry about, letting, the parents knowing. We can put them under that grant.
I see. When you mention about people who doesn't qualify for insurance, could you please explain who can't qualify and what are the reasons and how they can qualify for your grant, like for the benefits you offer, please?
Sure. So for instance, if a patient goes and sees health benefits and they don't qualify for insurance for whatever status is, so meantime, if they're under the age of 45 and they haven't had a tubal, because it's a family planning grant, we can have them fill out a form, and it asks for, so we go based on income. So they fill out the form, and then we let them know, okay, you qualify for the grant, and some of them have co-payments, some of them have not. They don't have to pay anything because it goes based on a sliding fee scale. So we have some undocumented patients that don't qualify for even
Mass Health Limited.
Mass Health Limited or Health Safety Net, which is the free care. Some of them don't qualify, and if they qualify for the grant, we will use the grant for them.
Could you please explain to us some of the criteria why they don't qualify? Because we were just talking with Ren, and he explained to us one of the criteria to qualify, but for those who doesn't, it's because they don't have the years to be residents in Massachusetts, or what kind of the criteria do you use in order to know that they don't qualify?
That part I'm not really sure, because they come from downstairs after they see health benefits, and for whatever reason they don't qualify. We don't know that.
Okay.
They don't tell us. they just, we just communicate with health benefits, and they just tell us, oh, this patient didn't qualify for HSN or for Mass Health Limited.
But it qualifies for your program.
And then they ask us, do they qualify for the grant? And I just tell them to come up, and I'll have them fill out a form, and then we'll see if they, again, if they fall into the criteria of, they can't be over 45, and they can't, if they had a tubal, they can't qualify.
Okay.
So, but anybody under the age of 45, most of the time they do qualify, according to their income.
And what benefits they have when they qualify under, your program? Like what they can be offered?
So they come in for GYN exams, for the yearly pap smears, family planning. Like when said before, if for some reason they come and see us, and if they have family planning, we do, depending on the test, we send them to Lord General. Most of the time, if they don't, we have to send them to Boston because of, their insurance status. It gets kind of tricky is if they don't have anything other than family planning, that it gets a little tricky because that means they don't have no insurance, and we have to wait till they reapply again. For whatever reason they were declined before, we have to wait, and then we have to send them to Boston. Most of the time, when they reapply, they will get the health safety net.
Okay, like for example, somebody today doesn't qualify for a health safety net, perhaps next year will be able to qualify again, and maybe he or she will get the benefits of having that insurance, right?
Yes, either next year, or it could have been a simple, they forgot to bring a document, or it could be anything, when we just tell them, we communicate with the health benefits department, and if they say, well, she didn't bring this document or he didn't bring this document, then we will use the grant for that visit, and then we tell them to go see health benefits to bring the documents that they need, so that we can then send them to Boston for whatever procedure that they need.
To follow up.
Yes.
Yes.
But I really want to stress out to, especially to the teens, we know that they are afraid sometimes to, come to see us because of, oh, my parents are going to find out, but we don't report anything. And then even when they fill out the forms, or even older patients, they don't want to report any, they don't want to fill out the fee assessment form because they're afraid that we're going to, call immigration, or we want to stress that we don't report anything. All the information that we ask is for statistics purposes only, because we're grant funded, so.
Excellent.
Yeah.
So before we close our show, as you know, we always have a very short time learning about very important topics. I just want to ask you, what is the best way to reach you? And if you have a website, because now, everything is almost internet, and teens are capable to use internet. So if you can provide us with your website and a phone number, then we can reach you, please.
Sure. They can call the main number, the 937-9700 number. And we also have our own direct line that goes to the family planning department, which is 978-446-0236. They can reach me there. The website is www.lchealth.org.
Okay, thank you so much. Okay, so before we close, we just want to ask again, Ran, if you have any recommendation for our audience. Ran and Rosa, thank you for being with us here at Colores Latinos TV. Thank you for supporting our show with this great information for our audience. So I'm just going to pass the mic to Ran before we close.
Well, my recommendation is if you don't have any health insurance, you should apply. And if you don't really understand, if you're not still aware of who should be eligible for Mass Health or Connected Care Plan or Health Safety Net, what the income is eligible. If you're not aware of that, then just come to us and try. It doesn't hurt to apply, and just apply. And if you qualify, then you qualify. If you don't, then you don't.
Excellent.
So you should try to get the best health insurance you should you deserve. And please don't be afraid. And although you, as we have mentioned earlier, if you don't have any immigration documents, just don't be afraid. Come to us and we can help you with that.
Thank you so much, Ron and Rosa, for that information. We appreciate that. Thank you.
Thank you.
So as you know, you're watching Colores Latinos TV. If you want to reach us, please do through our email, coloreslatinostv@yahoo.com. Also, you can follow us on Facebook and watch this interview on YouTube. Thank you so much and see you soon.
El Comité Cultural Colombiano del Merrimack Valley te invita a su tradicional fiesta, Noches de Cartagena, y a celebrar sus 20 años de aniversario. Fecha, sábado 15 de noviembre. Lugar, Elks Lodge, 652 Andover Street, Lawrence. Hora, de 7 a 12:30 p.m. Entrada, $55 por persona. Incluye cena, con DJ Baby Paisa y una agrupación sorpresa. Para más información, llama a Claudia Hoyos al teléfono 978-476-1971. Damas y caballeros, traje elegante. Ven y disfruta con nosotros. ¡Te esperamos! Hola, bienvenido de nuevo a Colores Latinos TV. Soy Nancy Peña. Hoy estamos haciendo una entrevista muy especial con el Padre Joel Almono, quien es representante y también participa en lo que es la Feria del Libro Internacional acá en Lawrence. Como ustedes bien saben, Colores Latinos está siendo producido en el área de Lowell, pero estamos siendo transmitidos en 28 canales en el área de New England y un canal en Nashua. Y gracias a nuestro canal de YouTube, somos vistos en Latinoamérica y Europa. Vamos a dar la bienvenida al Padre Joel Almono, quien nos va a explicar un poco más sobre lo que es la Feria del Libro, autores, quienes participan y cuáles son, pues vamos a decirlo de esta manera, quiénes son los autores que nos visitan este año, las personas que participan locales y también vamos a hablar un poquito de la historia de la Feria del Libro para aprender un poco más. Vamos a dar la bienvenida al Padre Joel Almono. Padre, bienvenido a Colores Latinos, es un placer tenerlo por acá. Y esperamos aprender mucho sobre lo que es la Feria del Libro. ¿Cómo está hoy?
Muy bien, gracias. Y damos las gracias a Colores Latino por mostrar interés en conocer lo que está sucediendo en esta parte aquí del Valle del Merrimack, especialmente en la ciudad de Lawrence. Esta será nuestra 9ª entrega. Como podrán notar, cuando ya uno tiene 9 años en un proceso, pues quieras o no, pues ya se ha puesto los pantalones largos. En el caso nuestro estamos batallando por ponerlo, ¿no? Porque nos hemos enclavado con una visión cultural donde queremos que la presente generación de inmigrantes hispanos, como la futura generación, que en este caso ya no es de inmigrantes, sino de hijos de inmigrantes nacidos aquí en Estados Unidos, puedan valorar, apreciar y retomar la cultura y llevarla un poquito más hacia adelante. Este año la feria está dedicada nada más y nada menos que al gran poeta de la generación de posguerra en República Dominicana, Tony Raful, y tenemos además reconocimiento que lo hacemos el sábado por la noche en lo que denominamos la cena de gala, y el reconocimiento lo tenemos a 2 personas que han trabajado de una forma ardua como empresarios, pero para fortalecer la cultura. La señora Mary Guerrero, del restaurante Café Azteca y El Taller, y el señor Núñez, Alberto Núñez, que en la parte de los bienes raíces, ambos de una forma u otra han contribuido al desarrollo cultural de la ciudad. A ellos está dedicado el homenaje de la noche del sábado, y la feria de por sí estará dedicada al poeta Premio Nacional de Literatura 2014, Tony Raful. Además, tenemos la noche inaugural, que siempre tenemos un homenaje póstumo. El homenaje póstumo será al gran Premio Nobel de Literatura Latinoamericana, Gabriel García Márquez, el Gabo, gran escritor colombiano que nos orgullece, nos llena de orgullo a todos los latinoamericanos de todo el continente. Entonces, la Feria del Libro arranca este 16 de octubre hasta el domingo 19. En esta oportunidad hemos añadido un día, porque la feria comenzó solamente un día. Después se le fueron añadiendo más días y ahora, después de 3, estamos añadiendo un cuarto. Pero el cuarto tiene una finalidad y es permitir que la juventud se integre. Por eso le hemos denominado la preferia o la feria juvenil y va a ser el 16, pero la vamos a tener nada más y nada menos que en la high school, es decir, en la escuela secundaria de Lawrence, donde estamos esperando a unas 3,000 personas. Solo la escuela tiene 3,000 estudiantes en todas sus áreas y queremos invitar también a los padres para que puedan participar. Sí, hemos estado trabajando para que la preferia juvenil sea de gran éxito para que los muchachos se integren. Por eso la feria este año tiene un lema, que es el amor a la literatura de generación a generación.
Déjeme preguntar, con toda la información que nos ha dado, me parece muy... Obviamente, primero felicitarlos por la gran labor que han hecho año con año. Como usted dice, ya son 9 años que tienen trabajando en la feria y este año ustedes están integrando también lo que es la juventud, que me parece que es muy importante y muy vital, especialmente ahora con tantos hechos de violencia y desasosiego y otras cosas que pueden estar pasando, es que es importante integrar a los jóvenes y me gusta mucho la forma que usted lo dice, los hijos de los inmigrantes, o sea que ahora ya no se refiere nada más al pueblo inmigrante, sino que a la gente que ya es nacida acá en Estados Unidos. Una pregunta que me gustaría hacerle es para nosotros acá en Colores Latinos aprender un poco más cómo inició la Feria del Libro, cuándo se inicia y por qué se inicia.
Mira, la feria se inició hace ya unos 9 años, como dije antes, y las personas que comenzaron este proyecto, el señor José Balbuena, que tuvo la primera librería latina aquí en Lawrence, llamada Librería Nobel, falleció, pero él junto con Asdrúbal Tejeda, que era en ese entonces presidente del desfile dominicano en la ciudad de Lawrence, comienzan la Feria del Libro, ¿no? La idea estaba asociada como un apéndice del desfile dominicano. Por eso era un solo día, era un solo momento, donde se motivaba que las personas trajeran libros, pero fue un tímido comienzo y así se mantuvo. Creo que esa vez fue dedicada en forma póstuma al poeta nacional dominicano, don Pedro Mir. La segunda, si mal no recuerdo, la memoria no me falla, fue dedicada al poeta dominicano, pero conocido como el poeta lorenciano actualmente, César Sánchez Vera. La tercera fue dedicada creo, a José Balbuena. La cuarta fue dedicada a un servidor y ahí es donde yo me integro, ¿no? Entonces, la subsiguiente fue dedicada a Mateo Morrison y a dominicano, en ese entonces ganador del Premio Nacional de Literatura, y también a la gran poeta, o como dirían algunos, la poetisa cubana Yanixia Canetti. A ellos dos fue dedicada. La del 2013 fue dedicada a la gran poeta del exilio cubano, antes, en 2012, fue dedicada al presidente de la Academia de la Lengua en Estados Unidos, un argentino excelente y miembro del número de la Academia de la Lengua en España. Estamos hablando del argentino Luis Alberto Ambrogio, ¿verdad? Y dedicada al gran cineasta puertorriqueño Jacobo Morales. La del 2013 fue dedicada a la gran poeta del exilio cubano, radicada en Francia, Zoe Valdés. Y la de actual estará dedicada al poeta Tony Raffol. Nosotros nos integramos y al integrarle entendíamos que no podía tener solamente el número para los dominicanos. Porque si bien es cierto que la etnia mayoritaria en Lawrence son los dominicanos, pero no está circunscrita a los dominicanos. Entendía que había que darle una dimensión diferente, que había que internacionalizarla, no solamente con las etnias que estaban acá, sino invitando a poetas de diferentes partes del mundo, como el año pasado que vinieron hasta de Israel, de España, de Francia, para poder hacerla internacional. Y los miembros del comité, entonces tenemos por ejemplo a Carmenza Bruf, que es colombiana, tenemos a Dolores Calaf, que es puertorriqueña, tenemos a una pareja de mexicanas que están integrados, peruanos, dominicanos, puertorriqueños, teníamos hasta española en el comité. ¿Por qué? Para darle ese carácter internacional, porque cada quien pues conoce dentro de sus propias partes lo que es mejor, y esto viene a contribuir en beneficio para la misma feria.
Padre, ¿dónde va a llevarse a cabo la feria? Que usted bien mencionó que iniciamos en octubre 16 como una preferia, ¿correcto? Entonces nos gustaría también pues invitar a las personas que nos están viendo dónde va a ocurrir, vamos a decir los datos básicos sobre es gratis, dónde va a ser la cena de gala, ¿cómo funciona eso?
Gracias por la pregunta. Hemos rodado un poquito porque no tenemos todavía una casa propia, es decir, la casa de la feria. No la tenemos, pero el último centro que nos ha dado albergue, que a mí me gustaría que fuese el hogar de la feria hasta que la feria tenga su propio hogar, es el Lowell Senior Center. Lugar de personas mayores, que está en la 155 de la Hayward Street. Ahora bien, en este año, el 16, que es jueves, tendremos la feria en Lawrence High School, en la escuela secundaria de Lawrence, para los estudiantes ahí. Pero el viernes es interesante, porque el viernes nos juntamos aquí en la iglesia, que es en la 35 de la Jackson Street, con todos los invitados nacionales e internacionales para darle un paseo por los lugares históricos de la ciudad. Todo el que quiera conocer sobre Lawrence, los lugares históricos de Lawrence, les invitamos para que nos acompañen. Vamos a tener un trailer para que puedan caber más personas y mostrarle los lugares no recónditos, sino hermosísimos de esta ciudad. Eso va a ser a las 3 de la tarde. A las 7:30 de la noche, aquí mismo en la 198 de la Garden Street, vamos a tener la noche natural. Esa noche queremos hacerla con esplendor. Hemos invitado a una comparsa de diablos cojuelos. A los que son caribeños conocen el término. Son los famosos macaraos, como decimos los ibaeños. Los diablos cojuelos estarán viniendo por todo el parque, tirando con los fuetes y los sonidos musicales de los fuetes, entrando, bailando, más de 18 personas hasta entrar de lleno para acá la comparsa. Yo sé que al principio será muy folclórico y después estaremos más tranquilos porque hemos invitado también al coro de la High School de Lawrence para venir y cantar al coro. Y vamos a tener una noche esplendorosa en la noche inaugural. Esperamos contar con la presencia de lo más granado de la sociedad lorenciana, dándose cita esa noche. Después de ahí, no termina. Nos vamos al taller que está en la Acceso Street. Es un lugar, yo le diría, bohemio, de literatura, de restaurante, abierto para tener una tertulia abierta donde vamos a poner que todo el que quiera leer, participar, traer sus cuentos, pueda hacerlo. El sábado vamos a tener a partir desde las 9:30 de la mañana en el Senior Center, que va a ser en la 155 de la Hayward Street, todo el día. En la noche cruzamos ahí mismo para estar en la Jackson, donde se encuentra el templo masónico, donde vamos a tener la cena de gala con la presencia de Ramón Orlando y su orquesta. Y el domingo volvemos otra vez a la 155 de la Hayward Street para cerrar con broche de oro la Feria del Libro. Para esta oportunidad, para el cierre, hemos invitado a dos artistas y ha sido adrede, porque el título, el lema es el amor a la literatura de generación en generación. Hemos invitado a Aníbal de Peña, que es de la generación un poquito atrás, y a Jacqueline Esteves, que es de la generación más joven, para que se cumpla eso de generación a generación.
Me parece que la feria va a estar bastante interesante. Esperamos nosotros, Colores Latinos, a poder asistir a algunos de los eventos para seguir cubriendo y darle también la importancia necesaria, no solo cubrir lo que está sucediendo hoy, lo que va a suceder en octubre, pero qué fue lo que sucedió en octubre, porque sería interesante tener datos, información, videos, algunas entrevistas para ustedes, para que ustedes vean con el fervor y con la viveza lo que se va a vivir en Lawrence en este octubre, y recuerde que es año con año. Vamos a hacer otra pregunta, padre. ¿Quiénes pueden participar en la Feria del Libro? Vamos a decir, si alguien nos está viendo en el área de New England y dice, caramba, yo soy autor, yo he escrito, me gustaría participar, me gustaría ser miembro de esta feria. ¿Cómo puede la gente abocarse a ustedes?
Excelente pregunta. Todos los que nos están viendo, que tienen texto, que dicen, bueno, son inéditos, yo no me he atrevido a leerlo, pero me gustaría darlo a conocer, acérquense, vengan acá y participen inclusive en la tertulia abierta, donde usted no tiene que estar pasando por ningún sedazo ni por ningún canon para decir si es bueno o es malo. No, aquí lo que vamos a divertirnos en esta feria abierta, en la tertulia abierta del viernes 18. Usted trae su texto, usted ha publicado ya, o sea, no son inéditos, ha publicado y quiere también darlo a conocer, venga, que nosotros somos abiertos y lo podemos poner ya no en este año, pero sí el próximo año con muchísimo gusto, porque la intención o una de las intenciones de la Feria del Libro es dar a conocer el talento hispano desarrollado en los Estados Unidos. Primera, segunda o tercera generación de inmigrantes, bienvenidos. Pero aquellos que dicen, bueno, pero eso solamente es para hispanos. No, fíjense que este año y el año pasado vino un gran escritor, pero es psiquiatra, que fue el asesor en la Casa Blanca sobre terrorismo, Roeun, y él viene este año con su libro en español y va a dar una charla en español. ¡Qué bueno! O sea, lo importante es que la dio en inglés y ahora quiere darla en español y que viene a participar. No hay limitación, no es solamente para hispanos, es internacional. Por lo tanto, todas las culturas, todas las etnias y todos los escritores son súper bienvenidos con nosotros.
Excelente, padre. Estamos escuchando y podemos ver la energía con solo tener al padre acá, Joel, la energía que él inyecta. Entonces, usted se imagina cómo va a estar esa energía, no solamente de él, sino de que las personas que participan en el comité, escritores, gente que voluntarea, porque también hay que agradecer a la gente que está atrás del comité, que es mucha gente que está trabajando no solo en la Jackson Street, en el Senior Center, en el taller, si no mal recuerdo usted mencionó. Entonces, toda esa sinergia que estamos trabajando va a ser muy bonito. Entonces, esperamos que las personas que nos estén viendo puedan atender esta feria, y si no, pues para la próxima, el año 2015, que yo estoy segura que va a ser tremenda feria, como la que usted está mencionando que va a ser este año. Y esperamos invitarlos a que ustedes participen también, no solo como espectadores, pero que participen directamente si tienen algún texto que quieran compartir con nosotros. Estamos ya casi por terminar nuestra entrevista, y lo último que le quiero preguntar es si nos puede decir a dónde las personas se pueden comunicar con usted o con alguien para la Feria del Libro, y si tenemos algún website que la gente pueda visitar para nosotros publicarlo, por favor.
Claro, tenemos website, la Feria Internacional del Libro en Lawrence. Tenemos también la página en Facebook, se llama Lawrence International Book Fair. Pero hay una cosa que sí quería comunicarles. Si desean llamarnos para adquirir alguna boleta e ir a la cena de gala o participar para la próxima feria con sus libros o sus escritos, porque no tienen que haber publicado, los inéditos también son bienvenidos. Llámenos al 978-902-6285. Que repita, claro que sí, 978-902-6285. Ese es mi celular y ahí con muchísimo gusto estoy para atenderle.
Padre, ha sido un placer de verdad tenerlo acá en Colores Latinos TV, y le deseamos muchos éxitos a la Feria del Libro hoy 2014 y los próximos venideros. Muchas gracias por su participación y estar con nosotros en Colores Latinos TV.
Gracias a ustedes por la invitación y gracias a los amables televidentes por su sintonía.
Recuerde, usted está viendo Colores Latinos TV. Si nos quiere escribir, puede hacerlo a coloreslatinostv@yahoo.com. Nos puede visitar en Facebook y en nuestro canal en YouTube, Colores Latinos TV. Muchas gracias y hasta luego.